Hey there, my name is Austin Lopes-Severo, and I'm the host of Life Insurance Academy podcast. Today we're putting out a special episode to address many of the questions and concerns of those in our field around the coronavirus. At the time of this recording, the world is facing a global pandemic known as the coronavirus, or COVID-19. This novel virus affects many of the people we see each day, which leaves many agents wondering how to keep ourselves and our clients safe while still serving our market. Now, while our show normally focuses on agents and how they can become more profitable and grow their business, today is not about that. This is a special episode where we hope to help agents navigate this current evolving situation. I'm joined in the studio by Chris Ball and Roger Short. Roger, can you give a quick overview of the things the agent should be mindful of in today's field?
Well, obviously, in the last 24 to 48 hours, there have been a lot of changes and a lot of impacts by cities, by governments, organizations, states even, on how to, stave off the spread of this virus here in the United States. Sports organizations have closed, shut their seasons, churches, the gatherings, the grocery stores. I mean, it's being impacted everywhere. And it's on the top of everyone's mind. The media is obviously communicating this at a high level. And so as a result of that, people have a heightened sense of awareness of what's going on, and people are nervous. It makes people nervous, and it causes uncertainty and fear. And so as they see these things happening, they're wondering what's going to happen, how this is going to play out. Even in our hometown, their hometowns, their kids and grandkids are now having schools canceled. Like our school was canceled here in Jefferson County for the 2 weeks prior to spring break. So it's going to be 3 weeks and maybe longer. Who knows? I just talked to an individual today on the phone who's from Ohio, and their daughter, who's going to Ohio State, is actually moving home this weekend, and all classes are going to be done online for the rest of the semester. I mean, so there's a lot of changes taking place. Our client base, particularly our seniors, Austin, in that final expense marketplace, are the most susceptible to this virus. And it's on their minds, what's going to happen to me? Likewise, at this very same time, they probably also have a heightened awareness of their need for medical insurance, health insurance, and even life insurance. So these things are all happening at the same time. It's very interesting where we are today.
And Austin, I'm glad you mentioned this on the front side, but this episode isn't so much about the agent profitability. I mean, all our episodes are. At the same time, this is more about navigating this time in American history and in our market. And it's not what I don't want is I don't want to see people use this as a tool to sell life insurance. I think that might have a little tackiness to it. If you're afraid of COVID-19, then you should buy life insurance from me on Facebook. We don't want to see
no, we definitely don't want to see that.
This isn't what it's about. Ultimately, today is about what the heck am I supposed to do as an agent, and what can we do to serve our clients?
So with that being the case, though, what can agents do while being mindful of everything that's going on and being mindful of their clients?
Well, first of all, we want to say right up front, if you're an agent and you're feeling sick, then stay home. Don't go out. Obviously, it's one of the first recommendations on the CDC website. cdc.gov, coronavirus. You can go there and find out all the information. But if you're feeling sick, we certainly don't want you going into homes and bringing possibly something to your clients that could impact them mortally. So we don't want that happening. Also, another big recommendation, if you're about to sit with a client or you have an appointment set with somebody, or you're at the door and they're demonstrating symptoms or they're symptomatic of the COVID virus or similar symptoms to influenza, pneumonia, that type of thing. You want to reschedule with that person. Clearly, these are obvious steps to take right up front. But obviously, if you're well and you have clients that have made requests, and interestingly enough, as an organization, obviously we do lead generation, we're getting responses in today, like during the middle of all this, during the press conferences about it, like lead responses are still coming in real time. So people are still wanting information, and maybe because of the heightened awareness of that need that I spoke about just a few minutes ago. So what can you do? Well, first of all, one of the things that we're recommending is that you as an agent or an agency, if the group that you're working with does not have a policy implemented, then you need to implement one, and you be the organization of you that implements the policy. Again, you're in business for yourself. It's you, Inc. So treat it that way, and create a policy of what you're doing to be proactive. Have a document on hand ready to be able to provide to your clients at the door if necessary to set people at ease and provide a level of comfort and peace of mind about meeting you. To talk about these important benefits. And so our organization, I think we're going to make this available to everyone who's listening. There should be a link somewhere on the notes of this podcast. We've provided an update for anybody who wants one. And essentially, I'm going to review some of the things in there. It just says that our staff considers the health, safety, and well-being of our clients, team members, and representatives and representative agents as a top priority. And as such, we are monitoring all updates to ensure our guidelines meet and or exceed the recommendations from the CDC with regards to our daily interaction with clients and other team members. So here are some of the precautionary steps that we'll be taking moving forward as we continue to track this situation closely. 4 main bullet points that we've included here that you can use this document at the door if needed, or in the home, certainly when you're sitting down. We'd want you to do that, or over the phone if you're appointment setting. But here's some of the main bullet points. All agents are to practice social distancing, which is during this precautionary time that agents will respect a 6-foot space between agents and clients with no handshaking. Wave, let them know, saying, hey, we're being sensitive to your health and our health, and we're just going to wave. Even though I'd love to shake your hand or give you a quick hug, I'm just going to smile and wave, and we can do some air high fives, okay? Let's do that. Secondly, all agent items are to be disinfected before and after each client interaction. So whatever you're using, your materials, your presentation, your binder, flip chart, anything that you use like that. Clipboards, whatever you have. Wipe that down. Take some Clorox wipes. There's a shout out. Take some of those disinfectant wipes with you in your car. Wipe these things down. Make it a practice between each client interaction that you have, and just be sensitive to how things are transmitted. Thirdly, if you come up against someone who may be symptomatic, then we're going to reschedule with those people. Clearly, if you're at the door or in the home and someone's displaying signs that might be symptomatic of that, then you might want to suggest rescheduling that appointment and that visit, and tell them that you can even do this over the phone. If you've got an initial contact made, you can say, listen, we can take the rest of the steps over the phone. Let's go ahead and schedule that for tomorrow or the next day. It's a great way. You've made initial contact. You've gained some trust. Now you can follow up over the phone and do the rest over the phone. And we can talk about some carriers that you can use for that in just a few moments. Obviously, you want to be sensitive to what the symptoms are. If people have a bad back or they've got knee pain, that's different. That's not something that should stop you from moving forward. Sometimes people will confuse upper respiratory sinus infections or seasonal allergies. It was clearly stated by the head of the CDC that those are not symptoms of the COVID virus. It's more symptoms like the flu or pneumonia. And respiratory breathing issues. These are more in line with that. So pay attention to that. You want to reschedule those or do them over the phone for sure. And then lastly, if you're not feeling well, of course, as we said at the top, our 4th bullet here is that we encourage our agents to stay home if they're not feeling well or they may be symptomatic. So we use this document as a piece to bring some confidence, peace of mind, as a reference point to walk through that.
So the one thing that we didn't want this to be used for is when you knock on a door to pull this sheet out and go over it with your clients, because you don't want to create a barrier that doesn't exist. This is just there for you in case it's brought up, just so that they understand we're sensitive to them as human beings. I mean, they may say something like this, Roger, I can't really talk to you right now because I don't want to catch that carne asada virus, or something like that. They don't know. They just heard some things on the news and they might be afraid. So all we can do is pull out this sheet and say, Mr. Smith, I totally understand. I just want you to understand that we've taken this into consideration and we're following all CDC practices for this. We're going to give you your space, and we've disinfected everything. So I wanted to show this to you.
What you all aren't seeing is Chris is showing the document
Thank
to
you.
me from a distance and,
Yes.
and pointing line by line. He's not handing it to me.
Right.
We did a training video on this for our team where it's in the back of the clipboard. It's not on top, on top of your leads, and you only pull it out. But not handing them that sheet because then that's infected. So. Put it in a sleeve, one of those protector sleeves, so that way if someone does touch it, laminate it, you can wipe it down.
Yeah, you can wipe it down. So the point is you're showing them and just pointing to the headlines of what the steps we are taking. And at that point, I'm just going to say, Mr. Jones, I'm going to go grab your stuff and I'll be right back. And I'm going to turn to my car and go get my materials. But like Roger said, we want to be sensitive. We want to acknowledge it. But we don't want to just buy excuses because somebody doesn't want to talk to us, or they have the same reasons they're saying no any other time. It's just masked differently.
Yeah, I mean, how many times do you hear people say, well, today's not a good time, I'm just not feeling well, or, I don't feel 100%. I mean, those are some things that you're going to have to discern. But please know to have this ready and available that you can point to steps that we are taking and you are taking as an agent to ensure their safety and ours while we continue to serve their needs and answer their requests.
This is an appropriate response. It is an appropriate response. And the inappropriate response is Mrs. Jones comes to the door and you say, oh, you don't believe that stuff, do you? This is blown way out of proportion. I'm going to go get your stuff. Like, that's not sensitive to a concern that a client has. So that's all we're doing is we're treating them like human beings, just like we want to be treated.
Yeah, we don't want to be dismissive of it. We want to address it head on with confidence. And Chris and Austin both, I mean, when you're communicating from a position of confidence, things go much better. And with certainty. People want certainty and they want confidence. And if you're taking appropriate steps and actions and they feel confident in the steps you've taken, generally things go well. So if you're getting an objection, you can use this document. On the phone, when you're setting an appointment, you can let them know. Say, hey, listen, I want to set up a time to come see you, but please know up front that we do practice these provisions here, which I'm going to outline for you. So we are taking full measures so that everything and everybody's going to be safe. And we want to follow these all the way through. This is an important thing.
So as far as this goes, with appointment, let's say door knocking, if you have questions about door knocking, the best practices, go back to our podcast, episode 10. Episode 10, review it. And this is a supplement to that podcast. Mm-hmm. Now, appointment setting. We will be talking about appointment setting in our very next podcast. And that will be released on Wednesday. Be prepared for it. And it's the same thing. This is a supplement to the information that we're going to give on that podcast. Ultimately, people, here's a hint, okay? People want to know who you are, why you're calling them, and what you want. So that's it. And we're going to address those things. And then if this comes up, you can pull this sheet out and have that same conversation about the steps we're taking following the CDC practices. So just be confident and have the conversations with the clients that you need to have, whether it's at the door or on the phone.
It's interesting, Chris, that you said that. One of the things that we talk about in this upcoming podcast on the on appointment setting, and even when we did on door knocks, who are you with, and why are you here? Yeah. Those are questions that people have running through their minds that are not verbalized. Well, an additional question that they have right now that's not verbalized is, what about the coronavirus?
Yeah.
It's going through everyone's mind. So for us not to address that would be disingenuous and dismissive. So we're going to also answer that question for them, and we're going to be proactive about that.
Yeah. Now, one thing that I just want to highlight or clarify is the timing of this. If they bring it up at the door or on the phone, you can share this document or whatever you're doing to prepare.
Correct.
Now, if they don't bring it up then, we still want to bring it up, but maybe wait until you're in the home to say, hey, this is going on. You're not turning a blind eye.
Correct.
But you're not, like Chris just said, you're not creating your barriers at that initial point of contact.
Correct. You will always bring it up when you're sitting with them, because that also enables that trust building phase. When we talk about establishing trust with clients, this is a big piece of that, because one of the questions racing through their mind is, what about this and how's it impacting just our interaction? So it's a question. So address it and be upfront and share our communication and our practices.
Are there any other options for agents that might be experiencing kind of higher levels of challenges or objections than their normal day-to-day?
Yeah, I mean, so if you're doing mostly face-to-face sales and that's been your practice, a really good option would be to consider non-face-to-face sales or telesales using the phone. A lot of us book appointments over the phone to see clients. There's no reason why we can't have calls with clients on the phone about their request for life insurance. There's organizations that do it exclusively. There are telesales organizations and groups. So to have some good telesales or non-face-to-face eligible carriers in your arsenal, I think right now is probably really important. For you not to have that, you're probably missing a piece, a very important piece, and a product to serve clients in a different environment like this one.
Roger, now one thing you just mentioned there is having carriers. What qualifies a carrier to be, one that's good for telesales?
Well, I mean, in the final expense space, there are some carriers that you have to be face-to-face with. And so if agents are out there and you have carriers that you're already working with, you'll know whether or not you can take a phone app or a non-face-to-face app. There are other carriers that have made it possible to do non-face-to-face sales. In some cases, it's strictly a telephone application where you can do a three-way call, bring on the point-of-sale interviewer with the underwriting group, and you can complete the whole thing there with a voice recording and get it done over the phone. An example of a company that would be Liberty Bankers Life. It's one of the carriers that we have access to and we represent here. Assurant with American Memorial Life is also another carrier that you can do over the phone like that. Prosperity Life is another one. There are some others that have e-apps available. Mutual of Omaha has a great e-application through iPipeline for almost all of their products, actually, for final expense and for their term products, for mortgage protection sales. Foresters Financial, there's a lineup of their products, and the Smart UL and the Strong Foundations, Easy Term. There's different products available that you can take in a non-face-to-face application. So there are some good carriers out there that if you have them in your lineup and ready to go, you can service those clients. So whether you meet them at the door and then they feel uncomfortable and you set a follow-up to do the rest over the phone, or whether you call them on the phone to follow up on a new lead and say, hey, listen, because of the sensitivity, I would normally come out and see you, but we can go ahead and get some information for you right now over the phone. I'd like to ask you a few questions. Is now a good time for me to go through that with you? It's a great segue into that.
Yeah, or if you're at the door and you get those objections like, well, we can continue this. I'll just jump into my car, give you a call real quick, and continue the sale on the phone in their driveway.
Literally, you could do that. Yes, absolutely, 100%. There's no reason why you can't. If that's a concern and they're comfortable with that process. So, I think if you, there are some other opportunities. I guess if you have a lead inventory of unretired leads, or maybe some lapsed clients that were on the books that are now not on the books anymore. These are all great opportunities for you to call through those, even over the weekends, maybe in what would be a non-working time, especially with kids being at home and lots of other issues that might be going on. I mean, you have to think creatively outside of the box. How am I going to make my business work, serve my clients, take care of my family in the middle of this? How do we do that? If you're a Ford worker and you're on the line making cars, it's a little difficult to work from home, right?
Yeah.
Obviously, as life agents, we have options. And so we can do this face-to-face or we can do this over the phone. You can do it online. You're probably still going to need to be on the phone, but yeah, you can do it online and walk them through an e-application. So if you think outside of the box, use your leads that you have, use your lapsed clients. You can even call back and do policy reviews to help people understand. There is a heightened awareness right now. So there's two things, Chris, going on at the same time. People are concerned. They don't want to get sick. They don't want to expose themselves to sickness. At the same time, they have this other heightened concern about their insurance and the need for it. Life insurance, health insurance, like, do I have enough? Is my family going to be protected? So both these things are like, they're at odds with each other, but at the same time, they're heightened realizations and needs for families.
Yeah, yesterday, Forbes actually put out an article saying that there's a company out there that has noticed 50% increase in life insurance sales right now because of this awareness. And so the opportunity is still there. The need is still there. Like Roger said, you have to get creative while keeping your client and you and your family at the forefront.
Yeah. Ultimately, if agents are looking for some other great options, we have access to carriers. You can get in touch with us about those carriers. We can get you set up. There's also some telesales opportunities with a plug-and-play system. If you're interested in discovering what that is, we can make recommendations there. We have groups that work with us that do specifically that. And be a little bit of a learning curve, but it's something that's available to you. We just want to let you guys know that there are options out there. There are resources available. Don't think that your career or industry is over because people have some concerns. While there's a heightened attention to it right now, I am confident as a society and as a culture, as a country, as Americans in this country and globally, that this will be overcome. We'll figure out how to navigate this. It's going to continue affecting people. It's a reality. You have to address it. But like any other challenging time in our history, we've overcome things like this in the past, and
this will make us better.
I'm confident we're going to overcome it again. It's going to make our agents better to try to figure out how to navigate these things while being sensitive and confident and using all the resources that they have available to them. So I'm hopeful that some of these options and tips have been worthwhile, and we wanted to get that out there.
Thank you for listening. You can find the guide that Roger spoke about and other resources we mentioned, such as links to the CDC and some of the symptoms that you could be aware of the COVID-19 virus. And all that can be found at liapodcast.org/COVID-19. And again, if you're joining us for the first time today, make sure to check out some of our other episodes here on the Life Insurance Academy podcast. Hit the subscribe button and you'll get future episodes. You'll also get resources just like the one we had today to help you in your life insurance sales. Until next time, drive safely and go be a difference maker.